welcome. I'm excited to be here and discuss such an important topic. I wanted to start with life after stroke can present numerous challenges, but with the right support and strategies, recovery can be actually a hopeful journey. And so I look forward to sharing insights that can help stroke survivors and their loved ones navigate this path together.
Great. So let's talk about the effects of a stroke.
So, a stroke can lead to a wide spectrum of effects, both physical and psychological and cognitively, largely depending on where in the brain the stroke occurred and how severe it was. So, physically, many individuals experience weaknesses or paralysis, often affecting one side of the body. This condition is known as hemiplegia. Patients may also face difficulties with coordination or balance, making even simple movements challenging. On the communication side, these individuals can struggle with speech and language due to conditions like aphasia, which can affect their ability to express their thoughts or understand others. Or there's dysarthria is another common issue resulting in slurred or unclear speech. And then cognitive changes are also prevalent. So stroke survivors might face memory loss, difficulty with problem solving or reasoning, and challenges in attention. And it's important to recognize that these cognitive shifts can sometimes go unnoticed when the physical symptoms are more apparent. And lastly, emotional changes can be significant. So no one knows when a stroke is going to impact them. One day life is looking one way and then suddenly looks completely different. And this event can be traumatic for many of our stroke survivors. So many individuals undergo this emotional lability, or better known as mood swings, anxiety, and sometimes depression, which can further complicate the recovery. So all these effects paint a comprehensive picture of the impact of a stroke, emphasizing that recovery involves addressing not just physical rehabilitation, but also emotional and cognitive support.
So you were talking about the recovery process, and so that process, what does that look like?
So the recovery journey after a stroke is incredibly individualized, and one of the key factors is how quickly the stroke is recognized and treated. So early identification using tools like the BFAST acronym can dramatically enhance outcomes. So just in case our listeners or audience doesn't know what the acronym stands for, it's the BFAST is an acronym, which is a helpful tool designed to recognize the early stages of a stroke, enabling prompt medical intervention. So the quicker a stroke is identified, the faster treatment can begin, which is crucial for minimizing brain damage and improving recovery outcomes. So if we were to break it down, the B stands for balance. So look for sudden problems with balance or coordination. This can manifest as difficulty walking or lack of stability or unexpected feelings of dizziness. If someone suddenly feels unsteady or has trouble with their balance, it's essential to seek help immediately. The E stands for eyes. This aspect refers to sudden vision problems. So an individual may experience blurriness, double vision, or even the sudden loss of vision in one or both eyes. So if you observe any changes in vision that are unusual, it's vital to take these symptoms seriously. The F is for face. So it's facial drooping is a significant indicator of a stroke. So as the individual, ask the individual to smile. If one side of the face droops or appears uneven, this can be a strong sign of a stroke. And this can happen along with reduced ability to control facial muscles. The A stands for arm. So check for weaknesses or numbness in one arm. You can do this by asking the person to raise both arms. If one arm drifts downward or is unable to be raised fully, it may suggest a stroke. So this weakness typically affects one side of the body. The S is for speech. So look for difficulties in speech or understanding. So ask the individual to repeat a simple sentence. If their speech is slurred, strange, or if they cannot speak at all, then this is a red flag. And problems with understanding what others say can also indicate a stroke. And then T finally is for time. The final component emphasizes urgency. So if any of the above symptoms are observed, it's crucial to call emergency services immediately. Time is of the essence when dealing with a stroke. So as early treatment can significantly improve the chance of recovery and reduce the risk of long-term damage. So by familiarizing yourself with these symptoms, you can take immediate action when necessary and potentially saving someone's life or preserving their quality of life post-stroke. Nonetheless, let's say someone has used the BFAST acronym and now their loved one is in the hospital. We enter what we call the acute phase, so which is the first step for a stroke survivor, which is immediate medical treatment, usually in a hospital emergency department. So doctors will assess the type of stroke, is it ischemic or hemorrhagic, for example, and begin treatment to stabilize the patient. They'll probably utilize neuroimaging, like tests like CT scans or MRIs are conducted to determine the extent and location of the brain damage. And they'll also use medication depending on the type of stroke. Patients might receive clot-busting medications for ischemic strokes or treatments to manage blood pressure and other risk factors. Once stable, the rehabilitation begins. So many patients start this process while still in the hospital, but it can also transition to outpatient specialized facilities or occur at home, which we'll get to at a later point. And the length of recovery for an acquired brain injury, such as a stroke, can vary significantly from person to person. So several factors influence the duration and extent of recovery, which includes severity and type of strokes. So for example, there is ischemic stroke caused by a blockage of blood flow to the brain, and recovery may vary widely depending on how much brain tissue was affected. Then there's a hemorrhagic stroke, which involves bleeding in the brain and often has more complications, which can extend the recovery time. Two, there's speed of treatment. So prompt medical attention can prevent extensive brain damage. So the sooner treatment begins, the better the chances for a quicker and more complete recovery. Three, there are individual factors. So like age. So younger patients generally have better recovery potential due to more neuroplasticity, which is the brain's ability to reorganize itself, put simply. Then there's overall health, pre-existing medical conditions like diabetes or hypertension can impact the recovery duration. And support systems, so strong emotional and practical support from family and friends can enhance motivation and engagement in rehabilitation. Four, there's the rehabilitation process itself. The intensity of therapy, focusing on physical, occupational speech therapy, often leads to improved outcomes. And although the duration of rehabilitation varies, patients may benefit from weeks to months of therapy as they transition from inpatient to outpatient care. So due to these varying factors, there isn't a one-size-fits-all timeline for recovery for a stroke or acquired brain injury, which is what a stroke is. So regular follow-up with healthcare providers, adherence to rehabilitation programs, and support from family can all play crucial roles in optimizing the recovery journey. So a vital part of this process is understanding that recovery doesn't always follow a linear path. So different domains like mobility, speech, and cognitive functions can improve at different rates. And acknowledging this variability helps set realistic expectations and encourage patients in the recovery journey.
Okay, so is that an important part of it too, to that people understand that their recovery could totally look different from others?
Highly individualized, highly individualized. And not just for all those factors I already mentioned, but also for their goals. And so that's probably one of the things I couldn't underscore the most is that, especially here in outpatient, it's very easy to compare yourself to other patients' recovery, and where we start off in our path and even the resources we have available to us can impact our recovery process.
Good. Okay, so I guess when we're talking about recovery, let's talk about exactly what it involves and where it takes place.
So stroke rehabilitation is comprehensive and needs to address the holistic needs to the individual. So when a stroke is severe, initial rehab may involve inpatient rehabilitation with a dedicated team of specialists. So this team typically includes a physical medicine and rehabilitation physician, nursing care, and possibly other therapists, such as like therapists, respiratory therapists, dietitians, etc. Will also include physical therapists, occupational therapists, and speech and language pathologists. In more severe cases, days or weeks may be spent in a specialized inpatient rehab unit focusing on intensive therapies. In addition, the individual receives 3 hours of therapy per day that can include physical, occupational, and speech therapy. As the patient progresses, the number of professionals involved likely decrease. Afterwards, for many others, outpatient care becomes the norm. So where the individual receives ongoing support after their acute phase. And it's important to note that depending on the patient's needs, the treatment teams will likely include a social worker, like a case manager, occupational therapist, physical therapist, speech therapist, and neuropsychologist. The rehabilitation settings can vary, including the acute care hospitals, rehabilitation hospitals or centers, outpatient therapy clinics, and home health services. And I want to emphasize that there are guidelines for specialized stroke rehabilitation, such as those from the Commission for Accreditation of Rehabilitation Facilities, aka CARF. So families should always consider about these certifications to ensure that they're receiving the best possible care.
Thank you. That's great. And I guess the other thing is people investing in their own recovery. I think our next question is about, for someone who has experienced a stroke, what are some of their short and longer term goals of rehab? And then with that, then how important is it for the person to invest in that recovery themselves?
So that's a very, I'll pin that last one, and please remind me to answer that one. But for the first part, your rehabilitation goals post-stroke are as diverse as the effects of the stroke itself. So short-term goals might focus on regaining basic mobility, such as the ability to sit up unaided or take a few steps with assistance, improving communication skills, and performing daily self-care tasks, even with help. Those can be short-term goals. Long-term goals, however, aim for independence. So this includes being able to manage daily activities without assistance, returning to work or social activities, driving, and achieving emotional stability. And it's crucial to recognize how these goals provide a sense of direction and motivation throughout the recovery process. If we were to look at goals by specialty, we would have physical therapy goals, which would be to improve movement, balance, strength, and coordination. This may involve training with assistive devices such as like a walker, AFO, etc. Occupational therapy goal would be to facilitate independence on daily activities such as dressing, bathing, cooking, school, work, and driving. They also address visual, perceptual, and upper extremity issues following a stroke. Then there's speech therapy goal, which is to improve communication and swallowing. This can include the ability to communicate thoughts and needs clearly, ability to understand others, cognitive skills such as attention, memory, problem solving, organization, and planning. And then there's a neuropsychology goal is to facilitate adjustment and coping following a stroke, because now life is looking completely different, and yet life is still happening, right? And so we provide a lot of coping skills while also conducting neuropsychological evaluations to assess the cognitive deficits and assistant treatment planning. And so treatment is very interdisciplinary, meaning that all disciplines are working to carry over skills addressed in other disciplines. So this means that a physical therapist may be working with a patient on remembering a home exercise program or attending to gain patterns while walking. The speech therapist may be working on recalling the transfer sequence from occupational therapy. And this approach, in combination with caregiver training, provides the greatest potential for generalization of strategies, which I'll get to in a later point, to functional activities within the home. So to answer the second part about the patient's motivation regarding recovery I would say, and I was going to get to this at a later point, but setting expectations sometimes, wanting to get to the recovery or back to our baseline as soon as possible, which is understandable considering what has just happened. But sometimes going too fast can slow down the recovery and patients can lose a lot of motivation. But their investment in rehab in itself is crucial. And I sometimes like to use the analogy of, if we were to go to the gym and hire a personal trainer, the personal trainer can't tell us all the things that we need to do, but the only person who could actually get on the treadmill is ourselves, right? And so the patient has a lot of, their investment is this big part of what we work on in neuropsychology, of that motivational piece of going through this therapeutic process, because this is going to be challenging. Imagine that you have to go to a place where every day you have to face the things that you're not good at. And that takes a lot out of people, right? Similar to losing weight, like in the beginning, it's easy, people are invested. But as time goes on, it gets really draining. It gets hard. You're constantly having to commute here. Can you even get transportation here? So it can feel very stressful, and it's easy and understandable why some people may lose motivation in their recovery process. I hope I answered the last
That
one.
was great. Thank you so much. I think the other question that we were going to ask about is, our patients have a lot of caregivers, whether those are the ones in the home with them or extended family members. How can caregivers first at home help? And then I'd like for you to talk about how other family members might assist also.
So caregivers are the backbone of the recovery process. They play an essential role in supporting their loved ones. We consider them as part of our team. So one of the big challenges of rehabilitation is carryover, or what we call generalization. So just because a person can do a task in a therapy clinic does not mean that they will automatically be able to do the same task at home. And the family can or does play a big part in helping modify strategies within the home. So also being the eyes and ears of the treatment team, so providing us with feedback as to what is working, what is not, so that the team can then adjust their approach to treatment accordingly. Also, caregiver support really evolves as, I guess another crucial point, advice I would give caregivers is that their support is going to evolve as the patient gains more independence. So initially, the caregiver, whether a partner or a family member, often takes on many of the tasks for the patient. And it's all about providing that essential help, especially when the patient may feel overwhelmed or unable to manage certain activities. But as time progresses, you start to see a shift. So the patient begins to do more for themselves, reclaiming some of the independence. And at this stage, the caregiver transitions from doing tasks for the patient to providing support. So maybe this is just lending a helping hand or encouraging the patient to tackle things on their own. And ultimately, this dynamic can lead to a more balanced partnership. And so the caregiver and patient might find themselves in a more collaborative relationship where they support each other as equals. And it's not just about caregiving anymore, it's about partnership and shared experiences, which can be rewarding. But one critical aspect caregivers they should remember is that it's okay to let their family members struggle with tasks. They need to relearn some of these skills eventually, right, as they progress. And safety should always be a priority. So allowing them to face challenges helps to build confidence and independence. And caregivers should also remember the importance of self-care. So caregiver fatigue is a real issue, and taking breaks can help immensely. We understand that this is easier said than done, but it's okay to ask family members or friends for help. Building a support network can alleviate some of that burden and allow caregivers the time they need to recharge. And can you remind me the last part of the question that you asked?
No, I think you started on it. How can people outside of the direct caregivers help? I think you start talking about maybe
Perfect.
supporting the caregiver, maybe, taking off task for them. Yeah, I think the other question was, the other thing that I would think about would be, uh, is there formalized programs for the caregivers to get some assistance also?
So that's such a good question. You know, yes and no. I can speak for our outpatient clinic. We do try to provide as much caregiver support as possible. They are invited into our treatments and sometimes even to therapy, and we give them resources where they can get support outside of here, particularly like counseling, emotional support, because this is traumatic for them too. Sometimes we forget that many of our patients, while in their stroke, they're actually not cognitively present, but the person who's actually bearing witness to this whole thing is actually the family member. And so they are left with a lot of traumatization as well, and their life has been shifted upside down. So I cannot emphasize enough the importance of having emotional resources and counseling outside of to process all of this. But I really wish one of the things that we had was more like a caregiver support group, but that can take a process. But as of right now, it's say family support and counseling outside of caregiver of rehabilitation.
So I see we have a note that there is a stroke support group offered the third Thursday of every month at 3010 Fair Road. I think that's in the Columbia market.
Yeah.
Yeah. And I'm not sure about the upstate market. If there is one of our facilitators who have that information, then that would be great to add that additional resource. And then the other question I had, and we have a couple other questions, I'll go back to those. You had given some tips about this, but I think we kind of talked about it in general, but what tips would you give, for really helping manage a stroke, at home? What things can people really do to help themselves at home?
So adjusting to life at home after a stroke involves creating a safe and supportive environment. So some practical tips for effective management at home are: one, create a safe space. So remove hazards such as loose rugs or clutter that could lead to falls, and ensure easy access to essential items. Consider installing grab bars in bathrooms or using shower chairs to enhance safety. A second one would be using adaptive tools. So whatever aids can support mobility and independence should be utilized. This can include everything from assistive devices like walkers or canes to adaptive utensils for eating. Then I would say encourage routine and engagement. So I cannot emphasize this one enough. establishing a daily schedule that incorporates therapeutic exercises like hobbies, chores, and social activities. Keeping a structured routine can foster a sense of purpose and accomplishment, and helping stroke survivors to feel more like themselves. Then there's also promoting healthy habits. I would say encouraging nutritious meals and regular hydration. So eating well and staying hydrated can significantly influence, physical recovery and emotional well-being. There's staying mentally active, engage in activities to stimulate the mind, like puzzles, reading, or playing games. And staying mentally active is just as important as physical activity in the recovery process. And lastly, seek social interactions. Isolation can be a significant challenge, whether through phone calls, video chats, or community events, such as support groups. There's a young stroke support group here at Rogers CPs. We have a aphasia group, we have a brain injury group. I know we have one other one that's escaping my mind. So if anyone in the audience can add that to the chat, that would be ideal. But staying connected to friends and family can boost mood and encourage socialization.
I have a note from one of our participants about, I think the person is asking that about the newest technologies related to stroke, because it said 10 years ago. I think they had may have had a stroke 10 years ago, and they're asking about, what are some of the newest things that are available to help now?
So I'll probably add a list of new devices. It's so funny that you mentioned that because we're just reviewing a research article about that. So I probably add some of those in our chat moving forward, but there are some additional devices to see coming from a neuropsychology standpoint. So there's a certain like EEG device to help, depending on where they put it on the brain. If let's say someone has a right-sided weak paralysis, when we want to have, and then that means that the left side, maybe the brain isn't working or vice versa, they'll put like this device on to help the patient move one side of the body, and it'll assess the brain mapping, and it'll help with cognition of almost like an aha moment of how to get like one side of the body to start working, or for the brain to make that connection to start making that part of the body work. But other than that, I would probably provide a lot more resources in our Q&A moving forward. And if anyone in the audience has more information, that would be ideal as well.
Neil, thank you. There is a question about different rehab therapies. If you could just kind of go over some of the therapies that we're currently using to help people who've had strokes.
So there's physical therapy, as I mentioned before, that's working on mobility. There's occupational therapy, which is to facilitate independence in daily activities such as dressing, bathing, cooking, school, work, and driving. They also address like visual, perceptual, and upper extremities. Then there's speech therapy, which is the goal is to improve communication and swallowing and other cognitive difficulties, such as improving attention, memory, problem solving. And it's hard to say specifically one particular task that helps in all of these kind of treatment plans because they're so individualized and they're so tailored. But a lot of problem solving skills of how to assess, stop, pause, kind of calmly think through all of these steps are some of the training tools that techniques that we use here. And then the neuropsych, the testing that we facilitate evaluations to assess for executive functioning. So how to make decisions, memory, how are we encoding information, and also attention. Is it auditory, visual, or even simple attention to more complex sustained attention? So the techniques can vary and are still very tailored to each patient.
Okay, so then I wrote down a question about, you had said earlier that caregivers really are in partnership with our staff. So you had said that sometimes it's good for the caregivers to know that they need to allow the patient to struggle sometimes with a task in order to continue moving forward. So I guess this is a two-part question. One question is, can the caregivers work with our therapists and staff to know when to do that and get some instruction on
Absolutely.
how to do that?
Absolutely. And that's here we're very much encourage caregivers to participate in treatment. And our team is constantly communicating these needs that, okay, almost anticipating that these changes are going to be coming soon. Because what we're trying not to facilitate is this learned helplessness, where we can become too patient can become too dependent on their caregiver, and so we want to make sure that doesn't start and we're not breaking any bad. We'd rather start with good habits and try to start breaking bad habits. So so we always encourage include caregivers within the treatment process, and usually like a speech therapist, occupational therapist will start that conversation with a family member.
So this is a question from one of our attendees. In regards to speech, is it recommended to help speak for the patient when they're trying to say some words, but they can't, or should we let them try to do it on their own?
That's such a good one. I think in the beginning, it can be really easy to try to help, when patients are struggling with aphasia, to kind of step in and kind of fill in the missing words, so to speak. And in the beginning, I can understand why this is helpful, but as a patient progresses in recovery, sometimes that could become almost a deficit. It's giving just the patient some time to let them get to the wording and remembering that the patient is still there, they're still them, and they're still trying to communicate. And so that's to say that yes and no, like in the beginning, it could be really helpful, but it may transition to partners kind of stepping back, and we want to teach the patient to kind of make those verbal connections on their own.
And that's definitely something that they could talk to our staff about if they're with the Prisma Health Facility about when to make that transition.
Absolutely, 100%.
This person is saying they had a stroke 2 years ago and they did not receive any type of therapy as it wasn't recommended by their neurologist. I seemingly was mostly normal. Would I still benefit for some type of therapy, or is it too late? I still have some pain and numbness and some memory issues.
So yes, it would still be beneficial. I would probably recommend like a neuropsychological evaluation in the beginning. I mean, obviously this comes from the recommendation from a medical provider. So anyone who comes here with us are referred by, so usually those are the emergency doctor. Then a patient may get referred to a neurologist or a primary care physician, and they will refer the patient to us. And we could do neuropsychological evaluations to assess for both strengths and weaknesses, and physical therapy. And should we find some deficits, from there we can have physical therapists kind of help with some of the mobility, and the speech or occupational therapist can help with those cognitive and memory changes. However, there is a bit of a timeline of recovery, right? And so the 6 months to a year is probably one of the most crucial phases. And it's not like recovery cannot happen past that point. It often does, but it may be more about teaching you the coping skills of, maybe you used to do things to remember one way before the injury, and now we have to learn a new way to do it. And so teaching you those skills about how to cope with this new normal would probably be more of our goal in outpatient.
Okay, what about when someone is going through recovery and they stall and they don't seem to be moving forward? They don't seem to be able to do any more than they were doing. I mean, what would you suggest in that situation?
So one, that is normal. I like to explain to our patients at some point, like recovery kind of feels like staring at a plant grow. Like if you just look at it, it seems like nothing is happening. And then all of a sudden, poof, there's like some small recovery, some small win. And then that could kind of snowball into some other recoveries, not all the time, but during those times and staying motivated to increase some depending, let's say it's cognitive challenges, to continue with strategies at home. This is where generalization really becomes a crucial part, where the skills that are taught in clinic are also applied at home. And so I would say, don't lose hope. It is still possible, but this is what makes this recovery hard. You're going to get better, but how much better and when? That's the one question I cannot answer for our patient, but it's continuing with the strategies and maybe optimizing some other areas, like making sure you're sleeping well, making sure that you're eating well, making sure that you're being physically active, depending if physical mobility allows. So, and if resources allow, please continue moving forward. But stalling and isolating and not using some of those skills can actually be a detriment to recovery.
Okay, so question is, I had a stroke 15 months ago and I'm still sleepy all the time and I have no energy. Is that a symptom of the stroke or possibly a medication?
Well, it could be a combination of both, right? Sleepiness is part, as the brain heals, it takes a lot of energy, and doing things that you used to do before are going to take you 3, 4, 5 times longer. And so that is a typical symptom post-stroke. But yes, medication, of course, can absolutely impact your fatigue, sleepiness, your quality of sleep, which then leads to restlessness throughout the day. And so those are things that I would highly encourage to talk to your primary care provider. And another thing is also informing your medical team, your primary care provider, that you've had a stroke. Sometimes that communication isn't necessarily communicated, depending if you're going from different hospital settings, but making sure that everyone on the team knows, like, let's say you have arthritis and hip pain before, you want to make sure that all your providers know that there's now been a new change, because the medication maybe that you were taking before can now impact recovery post. So there's a lot of factors why sleepiness 15 months post-stroke is normal.
So I think you emphasized this earlier, and I guess I just wanted you to talk through this again, that it's really important to communicate with your medical team everything that's happening to you.
Absolutely. I believe that Prisma does a really good job of doing that. But again, we have patients who are moving from different facilities, having everyone on the same page as soon as possible, re-seeing all your other medical providers as soon as you're able to post-stroke is really, really important, because a stroke can also inflame pre-medical conditions. And so all of those kind of things kind of interplay with each other, and having everyone on the same page is very, very crucial in the recovery process.
There's a question, and I think you answered this earlier, but I guess you could reiterate how soon therapy is recommended after a stroke?
Well, if we were talking about outpatient, almost as soon as possible, right? As soon as you can transition over. But inpatient is going to happen almost immediately. We need that stability, the acute phase, to be stabilized as soon as possible. But there is some kind of natural recovery to a stroke. So sometimes, like, getting treatment too early can fatigue the brain just a little bit. And so there's a sweet spot when I say, like, maybe 2 to 3 months post-stroke, we really already want to then be in an outpatient facility, the latest. But as soon as possible, to be honest, if you have the access and resources, would be beneficial.
The other thing I know that we've talked about before in general, and maybe you can help address this, that sometimes people who have had a stroke are at risk for stroke again. So, is there a way to address that at all?
Well, staying healthy now, oftentimes, there are very different reasons why someone may have a stroke. You could do everything perfect and still get a stroke, but managing health risk factors is huge. So If you weren't eating healthy before, we really need you to eat healthy now. If you have sleep apnea, we need to definitely control that. Diabetes, hypertension, all those things are crucial for management from this point forward. And what we can do is, our goal is to minimize the risk of having another stroke in the future. And so by doing all of those things, even staying emotionally healthy can help support recovery and, again, minimize the chances of having another stroke in the future.
You must have read one of our participants' mind, because the question was about sleep apnea. Does sleep apnea negatively impact stroke recovery, and should it be treated?
Absolutely, 100%. Even if you haven't had a stroke, you should manage sleep apnea. The chances of high risk of stroke goes up considerably if it's unmanaged and uncontrolled. But also, just, as the previous person asked about fatigue, what's happening during sleep apnea? As you're sleeping, your brain isn't getting oxygen, right? And so it's gasping for air, trying to get sleep. And so it's kind of waking itself up. So you're going to wake up restless. You're going to wake up tired. You're going to get fatigued. And what do we need for rehab and outpatient, at least, is we need the brain to be at its best so they can handle the therapies it's receiving. So I like to explain that the brain is a muscle, and while it's awake, it's kind of like doing a push-up. And when it's asleep, it's when it rests. And you need that good quality of sleep to help improve recovery. And so if you have sleep apnea, if you suspect you have sleep apnea, please go get a sleep study and use the CPAP machine. I completely understand why it can be uncomfortable, but the risk benefit is just, not worth it, or worth it depending on how you see it. But it can significantly improve a patient's quality of life. And even just like waking up rested, how big is that? And so again, when you incorporate that with rehab, they just kind of go hand in hand.
Okay, so we have another question. Are stroke survivors recommended to have additional neuropsychology evaluations every year, even if it's over a year past their stroke?
Well, as a neuropsychologist, I always like recommending neuropsych evaluations, but every year, I don't know about every year. Definitely, oftentimes when we get patients that come in here to rehab, sometimes you don't really need a neuropsych evaluation because it's very obvious what someone's struggling with. So let's say someone has a very poor memory. In an extreme isolated case, like let's say I'm reintroducing myself to that patient every 15 minutes. I know memory is impacted. I don't need a neuropsych evaluation to tell me that. But as patients recover and improve, there will come a time where we do have to do a thorough neuropsychological evaluation. Here at RCP, they take about 8 hours, because we're not just doing it for diagnostic purposes, meaning does someone have Alzheimer's or Parkinson's? We know what's happened. The patient has had a stroke. And so you need a full battery to assess strengths and weaknesses. I like to explain it like, Hurricane Helene mostly impacted Asheville, North Carolina, but we also felt it too. And it's the same thing when a brain injury happens, right? It may be localized to one area, but it could have ripple effects in other areas. And so we need to see what other areas have been impacted, but also we need to know what your strengths are so that we can utilize that in rehab. Now, once someone has fully healed or finished their recovery process, I would actually recommend another psychological evaluation, because it would be ideal to see how someone has stabilized post recovery. God forbid something should happen 5, 10, 15 years later. May not be stroke, but maybe like something like Alzheimer's or something. We want to have a baseline of where the patient was recovered so we compare that to the future. But I don't know if you would necessarily need that every year, if that makes sense.
It does. Let's see. I've had another question. Well, really a statement. My husband had a major stroke in December. Is there anything I can do to help him at home? It has affected his right side. So I walk behind him and say step by step, basically telling him what to do, helping him remember. Is that okay?
Well, first, I hope that uh, your husband, one, I'm sorry that that's happened to you, but I would say, hopefully your husband is in a rehab. I would say a physical therapist would be able to uh, help assist that if that's part of um, his deficits. For example, is he not remembering? Is he not paying attention to that? Is that what's really needed, or are there other factors? But should a therapist recommend that, yes, that can be very helpful in generalizing the cognitive challenges or cognitive processes needed to relearn to walk again post stroke.
So there's a question about returning to work. It says, when slowly returning to the workforce, is a survivor required to note TBI, disability, aphasia on their resume?
Oh, such a good and loaded question. That was a tough one. I would say, I mean, it depends on your job, right? Like if you're a surgeon who's having some fine motor skills, it might be something worth mentioning, for the safety of the public. But that is probably a decision depending, again, what your position is, what you do for work, and the how severe deficits are. That would be something where a case manager may be the best person to ask. So it's very individualized, but every patient here at the outpatient will have a case manager attached to them who's following them, their case, and they will be able to better answer questions like that. But all of that to say, it's dependent. How severe and what do you do for a living, right? Are we putting other people at risk? Are we putting yourself at risk? Otherwise, those kind of health issues are private. All those other things removed.
I'm looking, I think that is all the questions that we have. I'm just looking, give me 1 second, make sure I didn't miss anything. And our patient who was saying about her husband, that she just said that they're doing physical therapy and anything possible. That's great. We're glad that people are getting the care. Of course, Prisma Health is here. If you need an additional assistance anywhere, we have services in a lot of places. So if you need assistance, just let us know that. And I think we're down. I'm just making sure I don't have any questions. I want to answer everybody's questions. Oh, this is a good one. How do you deal with the emotions? They are very hard.
Well, that's my specialty. So yes, this is very hard. Again, it's very traumatizing. And I like to give the example of, what does the brain control? It controls everything, right? Cognition, physical symptoms, but also your mood. And as the mood symptoms, it's not uncommon for patients with strokes to suffer with depression. I believe the stats are about 70% will eventually get symptoms of depression. When during the recovery they're going to get that, that's still kind of up in the air. But we know that it's coming, but we also know that that's going to slow down recovery. And so managing this adjustment to a very, again, traumatizing event that's not just impacting you, but it's impacting your family members. And depending on what stage in your life you're in, can add additional stressors. For example, if you're a 40-year-old man who is the main provider of the family and now you're not working, and now there's this additional financial stressor. So learning these coping skills of what kind of thought process, maybe like cognitive distortions such as CBT that are impacting your mood are very important to manage. And also when a patient is struggling with emotional ability, like mood swings, that can lead with increased irritability, which then impacts someone's ability to problem solve, right? You're getting stressed out, so it's hard to think through things. And so a lot of our neuropsychological strategies are learning to, one, acknowledge and assess where you are with your mood, and then how to control it so that you could think clearly, cognitively, you're coming out at your best. But it's all hands on deck, and also sometimes even grieving what life was like pre-stroke. So all of those things, factors are really important. And again, if left unchecked, can really, really slow down recovery. And I don't think it needs to be said like it will impact a patient's quality of life.
So there were some more questions I wasn't aware of. I think that's a great answer. I think the other questions, yeah, I think about the emotional part. This is a question that I think is interesting too. It says getting answers on the cause of your stroke seems to be a very tedious process. For me, I still don't really have an answer on the cause. Have there been any studies on menopause or stroke correlation? There seems to be very little knowledge on how menopause impacts things. So I think this person's interest is on knowing what the cause of the stroke is. So what would you say to that?
Yeah, that's a hard one. I mean, sometimes it's kind of obvious, right? Depending on if, someone has had unchecked high blood pressure, diabetes, that's not been managed or controlled very well. Sometimes it's easy to assess the cause, but you're right, for many people, it's left unanswered. And as time progresses, that population becomes smaller, and we get, as we're learning more about how the brain and health is functioning. But that's an unknown that a lot of our patients have to sometimes struggle with, right? But nonetheless, and I understand why there's a need to, mostly for our patients, is, wanting to prevent a future stroke. But also at the same time, the stroke has happened, and getting the support of the here and now to improve your quality of life at this point is really important. But it's, this unanswered question that for many people struggle with, and I completely understand wanting to know why. Hopefully in the future, people will be able to get more and more answers, but that's probably still a little bit of a hole in research.
Yeah. There's a question about full recovery from stroke. Is it really possible to fully recover?
Yes and no. Yes, again, depending on the severity, where you were before the stroke, it is very possible to return to baseline. That's not out of the cards for anyone. However, or for everyone, I want to say. But even if you recover fully, the stroke has happened and it has probably changed your life in some way. And so you will be different. And in some ways, maybe that's a good thing, maybe it's not, right? But let's say, yes, it is possible. It's not out of the cards, but you, as a stroke survivor and family members, will still feel different because this has been a major event that happened. And then for other people, it's about getting as close to baseline, so pre-morbidly where they were, is really important, but learning how to adjust and learning coping skills. They'll deal with their therapist, speech, occupational, and physical therapist. They will be able to close that gap, right? So that you can still live a good quality life, similar to pre-stroke, but it just means you have to do things differently. And so accepting that those changes sometimes have happened, but that doesn't mean that we're not throwing the baby out with the bathwater, so to speak. And so life can still look the same, but you will probably still be different, is also something that's on the table.
Yeah, I think we have two more questions we can take, and then we're going to let Dr. Cabrera kind of wrap it up so we can be done on time. So one of them is, how do we advocate for a patient that had a mild stroke and may not be feeling like they're receiving the proper care due to a cultural barrier? That's what it says.
So that can mean many different things, resources, access, communication. So, I did some training with a cultural neuropsych, and one of the things that we would teach patients that maybe are culturally different would be, how to speak medical terms, right? How to speak how a doctor speaks. So not saying that you have to go to medical school and learn all these new strategies, but, how to communicate your symptoms, how those are impacting your life, those changes that are different, how they're progressing. All of those things are really important to communicate. So if we're talking about that kind of cultural communication, that's one aspect. If it means about resources, trying to get, even if it's a primary care physician, a nurse practitioner, someone who could add referrals to get you to neurology or a PMR physician is going to be really important. So the cultural thing can mean a lot of things, but if those two aspects are pretty crucial. Again, you also depending on language barriers, you have translators.
I think we have a final question. This is going to be our final question, and then I'm going to just give you a couple of minutes just to wrap up anything that you'd like to, your final thought. This person had very minor stroke in 2022. Is there recommendations about avoiding the over-the-counter like aspirin and those kinds of things? NSAIDs is I guess the way they say it, and other potentially harmful medications.
So again, that would probably best be answered by a medical physician. So because your symptoms and your care are just going to be, again, so individualized. And I think that's one of the hardest things about stroke is that, medication that may work best for one person may not for another. And that includes even antidepressants, medication or antipsychotic medication. And so those kind of questions, please speak to your medical provider as soon as possible when you have these concerns.
Good deal. So, wow, Dr. Cabrera, that is awesome. Thank you for all your great information. And so I'm just going to give you a final, you got 2 minutes, take a minute and just say, what are your final advice to patients and their families as they're recovering from stroke?
So to both patients and families, my final piece of advice is to prioritize self-care and open communication, as mentioned before, but I guess be patient with the recovery process. So progress may sometimes feel slow, but it's essential to recognize that every small step forward counts. So it's not uncommon, understandably so, that patients want to return to their normal lives quickly as possible, sometimes doing so at their own detriment, or returning to work or other responsibilities too quickly, which can lead to maybe them experiencing some setbacks, not necessarily health-wise, but cognitively. So taking it slow, encourage a spirit of celebration over these small achievements. So no matter how minor they seem, it's still a big thing. It's still a win. So keep the lines of communication open, not just about recovery, but also about stressors, proud moments, and challenges. Sharing and discussing these experiences fosters understanding and support. And finally, understand that recovery doesn't simply stop when formal rehabilitation ends. It requires continued effort and engagement in the community and personal interest. Remember, you're not alone on this journey. So there are resources, support systems, and communities willing to help navigate this life transition. And maybe embrace the journey of recovery, because every step you take is a step towards a brighter tomorrow. And so that would be my closing statement.